Hi, everyone, and welcome to the next episode of Welln'ish. Today, we'll be interviewing a very special doctor who is also one of my best friends, Dr. Tanya Herchibes. She's a family doctor in the West Island of Montreal, and she has she's done a fellowship to be able to practice with a specialty in obstetrics and pediatrics, meaning she can deliver your babies and follow them. Tanya has a very thorough and compassionate approach to her work, and every patient that I know who sees her is so delighted to be followed by her. All this to say, I'm so excited to have you here, and welcome to the podcast.
Thanks, Riley. I'm very happy to be here.
So I have a first memory of the first conversation we ever had wanting to become a doctor. So I was just curious what your first memory was of wanting to become a doctor or practice medicine.
It's hard to remember, one specific moment. I think in, high school, like many people say, I want to become a doctor later on. So I think a lot of us just kind of thought that without, actually thinking far enough ahead. Definitely like our gray anatomy days, watching those got people excited. But definitely far from what the real life doctor is. I think, I always knew I wanted to be in the healthcare field. That's for sure. I just didn't 100% know what exactly. So I had actually started off going to university in occupational therapy, which is a type of rehabilitation science. And even when I finished my bachelor's and my master's in that, I did start working as an occupational therapist in psychiatry, so in mental health. And I really loved that job, but I think I kind of got stuck in being only in one part of healthcare field. So, just in the rehabilitation aspect. And I wanted to be part of healthcare in a bigger perspective. So, from prevention to diagnosis to treatment and to healing. So I think that's what kind of gave me that final push of being like, okay, I think it's not just a high school fantasy anymore. I really do want to be involved from the very beginning to the very end. And I think that's what kind of pushed me to actually apply into medicine.
I love that. Well, I'm so proud of you. I know how hard you worked to get there. But I have really funny memories of everybody at Queen of Angels. We all wanted to be surgeons. And I'm like, it must be from the Grey's Anatomy push from when we first started. Because anyone who is in science, it was like, you must become a doctor. And I was determined.
And there's quite a few doctors and even surgeons that, just from our grade at Queen of Angels.
I was trying to think. There's Marika and Sam. Is there anyone else? That's still a lot.
Yeah, no, there's even more after that.
Okay, so funny. So I know there's a family tie, but I'm curious, what made you want to go into family medicine and what made you want to specialize after that within family medicine? So, your skill to be able to deliver babies. And because I think a lot of people don't know that in Quebec, family doctors aren't just doing day-to-day, you could probably say this better than I can, clinic. They also have to do some sort of, what's the word for it? Some sort of specialty where, they're on call on, I think in your case, it's almost every second weekend.
Yeah. So, family medicine in general, I was always interested in it just because it's such a broad field of medicine. I definitely knew I've always liked working with kids. That's been, since a young age. All my part-time jobs, summer jobs had always involved working with kids. And then the whole delivery aspect and following people's pregnancies, I think my mom definitely influenced me in that respect, unconsciously. My mom was a nurse in the case room for 30 years. So, childhood dinners revolved around deliveries and breastfeeding and boobs and, the more unusual dinner talks. But probably unconsciously over the years, it influenced me wanting to definitely go into that. So when I was in medical school, I was really torn between, do I go into pediatrics or do I go into obstetrics and gynecology? And I think the fact that I liked both of them so much is what kind of encouraged me that, why don't I do family medicine? Because I can get both of those and even so much more than that. So I think that's what kind of pushed me to definitely go into family medicine, and then for sure pursuing extra training so that I can have more of a specialty in kids and delivering babies. I think delivering babies itself is like, definitely in med school, it's one of the things I just remembered being so amazed with. Like the first, I don't know how many births, maybe like 20, 30 births, whenever a mom delivered, like I would just start crying. And I'd always try to do it like so that no one sees, because I'm, I'm not crying because I'm disappointed. I'm just like, wow, this is just truly an amazing process. And I remember thinking like, well, I don't know how I'm going to be able to do this job if I cry every single time. So now I don't cry anymore, but it's such a special field of medicine that it's just, okay, you need to be a part of it. So, yeah.
You've never told me that. That's so funny. So your mom, if you're from the West Island of Montreal, and have delivered at the Lakeshore, you probably know her mom, Mimi. And it was so funny because when I first started, your mom hadn't retired yet. And I kept hearing like, oh my God, if I wouldn't have had this one nurse there talking to me, encouraging me, I never would have gotten through it. And like, it was always my first instinct in my mind. I'm like, for sure it's going to be Mimi. And I would always ask, like, yes, it was Mimi. I couldn't remember the name, but of course I couldn't forget Mimi, like when you said her actual name. And, your family is a little bit more conservative, but just hearing you talk about the openness that you had about discussions about women and breasts, and it kind of makes me understand you more, like how open you are and how comfortable people are opening up to you. Because like we've talked about, going to a gynecologist, having gynecological exams, like those are not easy for people to go through. It's more invasive, but I know anyone who has ever seen you tells me how comfortable you make them. And I just think that's a testament to you, but also I find it interesting that part of that was probably brought on, like you're talking about breasts at a dinner table. That never happened in my family, when you're young. And I think that's amazing. I think that's a huge aspect of female empowerment that you learned young. And I just find that very special. Yeah.
My mom is definitely a role model. And I'm sad that as soon as she retired was kind of when I started working, because it would have been amazing to have worked with her. She was such like a positive influence on women in labor and delivery, and just being such like a powerful support person and really like an advocate for patients.
Maybe you could talk about this a little bit too, is that, the nurses delivering, they're really like the rock stars who are there with the woman through the whole labor. And I think we never see that in movies. And then women are often shocked when they deliver, and it's like, wow, I could not have done that without the nurses.
Yeah.
Like, I don't think they get enough credit.
The nurses, especially in labor and delivery, have such a huge role. They're really there every single step of the way. Not to say the doctor's not there, but they're definitely, there holding your hand with every single step. And so, they're a huge help, and we would not be able to do our job without the nurses that we have in labor and delivery. That's for sure.
So I'm sure a lot of people are surprised that you can deliver babies and follow them. Can you explain a little bit the training that you did so that you can do this as a family doctor?
Yeah. So, starting from medical school, since I knew, I liked kids and I liked the whole women's health field of medicine, from the very beginning, every, stage, so like any rotation that we had that was optional in medical school, I always choose to do it either in labor and delivery or in a pediatric clinic or emergency room. So when I went into family medicine, same thing. All my optional rotations I did were in that field so that I could be the most exposed I could be. Then when I finished family medicine at McGill, I did apply to a fellowship program in maternal and child health. So essentially this was after I was finished family medicine. I did this specialized training, and the training was really individualized with, kind of what you want to have more expertise in. So it definitely involved many months in the actual labor and delivery room. And with that, I did, rotations in different types of settings. So both tertiary care hospital settings, meaning higher risk settings, and also in community hospitals, and both in the English system and in the French system, just to expose myself as much as possible. And then also during the fellowship, we do rotations in the neonatal intensive care unit, other aspects of women's health, depending on, what we want to develop more knowledge and skills in, and the same thing for pediatrics as well. So just some like extra training that I got, really just to master certain things that I, as a family physician, really wanted to do with my practice.
Yeah, and you're even thinking about taking another course now to become a lactation consultant, right?
Yeah, exactly. There's never
striving for more.
It's never, the learning is never ending. So that's hopefully my next project in the upcoming year with you.
I hope it works out.
Is for us to do our breastfeeding course.
Well, I'm always so impressed by you. So can anybody go see a family doctor for their child's care or to be followed for their delivery? Essentially, what are the limitations to seeing you, and at what point do they have to be referred to a gynecologist? What kind of are the big differences between you and a gynecologist and obstetrics, and even, I guess, a pediatrician?
Yeah. So if we start more, the differences between like an obstetrician, gynecologist, and a family doctor in terms of, labor and delivery and pregnancy, a lot of it really comes down to risk, right? So, as family doctors, we generally see low risk pregnancies. Gynecologists or obstetricians, I'm going to use the words, interchangeably because it's the same specialist, but they are specialists. They are surgeons. Not to say that they don't see any healthy low risk pregnancies, but they're really trained to see higher risk pregnancies, meaning someone who can have either pre-existing health problems that can put their pregnancy at risk or make it even dangerous, or those who develop complications during their pregnancy that would require them to really be followed by a specialist to have that expertise. So it's not to say that in, family medicine, we don't follow people during pregnancy who have no health problems. In fact, we see a lot of patients who have different sort of health problems, such as diabetes or high blood pressure. We're still able to manage it, but sometimes we might need an expertise advice. So we might have to refer to a gynecologist or obstetrician to get that, further expertise, or even transfer the care depending how complicated it gets. There's for sure some areas that, we just don't even touch on at all in family medicine. So, for example, twin pregnancies, that's really a higher risk pregnancy. So, family doctors would not follow someone who has a high risk pregnancy like that. I think, one of the advantages of being in family medicine, though, is yes, we're trained to do this prenatal, so this pregnancy care, but at the base, we are family doctors. So we do a bit of everything, right? So often our view on pregnancy has, a holistic approach. It's a global approach. It's not just the pregnancy itself. There's many things that influence, right? Like your mental health during pregnancy can drastically change. Or if you're already going into a pregnancy, with your mental health that's, not at its optimal state, it's nice to have a family doctor because we can treat you and we can help you for that. So it's kind of nice in family medicine to be able to see pregnancy not just as this, unique one experience, but really this global aspect that accompanies with pregnancy and childbirth and having a baby afterwards.
So interesting. I love that perspective. It's so true. I wish that, I had thought of it in that way before, but it makes so much sense. And then what about for the pediatrics? So for babies, and then I guess after that you'd be following the patient for the rest of their life?
So so usually the pregnant patients that I follow, I do take on the newborns afterwards. This might not continue forever, but for now I am. And so essentially, some differences between pediatricians and family doctors. So again, pediatricians are specialists. They have further training, but really focused on pathologies, right? So things that are unhealthy, sickness, disease. Most of the time, newborns are healthy, and you don't really need a specialist care. So, especially at the beginning when babies are really young, the most important thing, you're focusing on is baby gaining weight well? Is baby growing? Are they meeting, their milestones? And it requires a lot of advice, about tummy time and, different exercises to do, how to introduce food. So, you don't necessarily need a specialist for those type of things. Not to say that, the babies and the kids I follow don't have health problems. For sure, I have lots of health problems in my family medicine practice with kids, but we refer out to pediatricians or other specialists as needed, depending what the issue is. It all depends on comfort level. There's some family doctors that don't see kids or newborns at all because they're not comfortable with it. So it's really like a range as a family doctor is what are you comfortable seeing, and to know what your limitations are and when you do need to refer to someone to get that expertise advice.
Okay. Makes total sense. So I wanted to switch the topic a little bit to kind of go into, I guess we get to call it intervention. So obviously I'm from the alternative health world, and the argument that I always see, which I can see its own flaws in, but I want to get your perspective, is just that, the only beautiful birth is an unmedicated birth, not at a hospital. So I wanted to just touch upon a few things. So the message that I also get from these sources is, if you're looking for an unmedicated birth, you absolutely should go to a midwife, because if you're going to a hospital, they're going to push medication on you. They're going to push intervention. They all want to get home to have dinner and be with their families, and they just want to pop them out. So I was just curious what your thoughts are on this, and would a family doctor be a good kind of in between for someone who, let's say, isn't comfortable going to a midwife? They like the idea, they feel safer in a hospital setting. But they're also trying to limit as much as possible intervention. Mm-hmm.
So, to start, I guess, with the whole, natural birth. So, when we talk about natural birth, we often talk about not having an epidural, to labor. And in terms of whether you have an epidural or not, whatever way baby comes, all births are beautiful, and everyone's experience is so different. I know there's there's a lot of negativity around, people who, let's say, had an epidural because they couldn't tolerate the pain, or they had a cesarean. But, the goal at the end of the day for any birth is that mom and baby are safe and healthy. And no matter, which way baby comes out, everything is beautiful. You literally created this little human from absolutely nothing. It's incredible. So no matter which way people decide to go, whether it's with a midwife or a family doctor and a gynecologist, always can be good and always can be natural. So of course, kind of comparing between midwife, family doctor, gynecologist. A lot of midwives, so not all, deliver outside of the hospital setting, whether it's, a home birth.
So I think that's something some people don't even know either. So there are you're saying there are some hospitals in Montreal where midwives can deliver the baby?
Yeah, there are some hospitals, not all, where midwives can go in and deliver. In Montreal, there are a lot of home births, though, and births at what we call the birthing center, which is where a lot of the midwives work. So yes, midwives, if you're with a midwife, you tend to have a more natural birth, meaning no epidural, less, let's say, medical interventions. But that doesn't mean that, being in a hospital setting, you can't have that. there's a lot of people that, go for an epidural, and a lot of people just come in with that plan, they come in, I'm getting an epidural, even though they're not even at that level yet. But you can totally have a beautiful natural birth experience in a hospital. And I think, that's where a lot of people say, oh, you're in a hospital, you're going to have interventions that aren't necessary, you're going to have an epidural forced on you, which is really not the case. Yes, if you want an epidural, it can be given to you in most circumstances, but it can also be natural from A to Z in a hospital setting. So as family doctors, we don't do home births. We don't deliver at like a birthing center. We really deliver in hospital, but we can go all natural. We can go on all fours. We can go in any position you want for you to have the experience that you want.
And, in hospital settings, from what I've gathered just from conversations, the nurses a lot of the time are working in a role where they're encouraging these things. Like, it's not like because you're in the hospital, you're doing it on your back and that's the only thing that's ever going to be discussed. Nurses are very highly trained. They'll encourage you. The nurse, I've treated a few nurses who work at the Lakeshore actually, and they'll say, tell your patients, like, one of their biggest tips is don't just lie down on your back for the whole day. Get up, move around, change positions, try different things, because it just like mentally keeps you going. So yeah, just to what you were saying, that there are a lot of resources. I don't know about if it's Lakeshore or LaSalle, but they even have some bathtubs, like the like Bosu balls and things to really support the women at the hospital also.
Yeah, there's so many things other than an epidural that can help manage your pain. I think probably every hospital, at least in Montreal, even outside of Montreal, has birthing like balls, to like while you're in labor, to use the ball with different positions to kind of help go through the contractions. And yeah, a lot of hospitals have baths, showers that you can use to have like a bit of like the warmth, and also just to kind of distract yourself a bit with the pain as well. So there's so many other ways other than medication and epidurals to help you get through the labor process.
So what are some ways that women, let's say they really want to have it in a hospital setting, what are some ways that women can have a higher chance of having an unmedicated birth in a hospital setting?
So something that's studied that we actually have a lot of evidence for, sorry, is that the best way to have an unmedicated birth is to have that support person there for you. Whether that's, your partner that you're going through this with, or a doula, but it's best that you have that support person there for you from beginning to end. This means having their like continuous presence there, giving you reassurance, and also praising you, being your cheerleader, walking you through each contraction, saying like, you're doing great. Yeah, like really guiding you throughout the whole process. And we know with study and research that having this person helps reduce any medical interventions. Now, of course, this is, going with the context that you have very uncomplicated pregnancy and uncomplicated, labor process. Other things that are, super, important, getting prepared before you go into labor. So this can be prenatal classes, or it can be any other sort of like research or course that you do, but kind of knowing what's to come. Like, what is labor? What are the process? Like, how long is it going to take? Not coming in and thinking 45 minutes later, baby's out and, I'm in recovery. Labor is a long process. So kind of knowing, what to expect, so that when the time comes, if there are interventions that are suggested or that need to become, you're also aware of what those mean, so that you can make an informed, collaborative decision with the nurse or the doctor that's there.
That's so important to highlight. Actually, Ryan and I were just talking about that, is that word collaboration, because the narrative surrounding conventional medicine is always like, your doctor is forcing you to do something and you have no input. But especially in that setting, you're making a decision with your doctors. They're going to be presenting you all of your options. It's not going to be a one option thing.
I mean, of course, there's always circumstances where, it's an emergency situation and emergency decisions need to be made. But, if you're going in uncomplicated pregnancy, uncomplicated labor, those decisions they should be made together with whoever is treating you and guiding you throughout the process.
Okay. Yeah, that's something that I see often, or like the feedback that I get from moms that I treat is that, if they had only one vision for their birth and it doesn't go as planned, it can feel very traumatic. And for a lot of women, to the point where they don't want to have a second child because their birth was so traumatic. Like they literally have PTSD from it. And a lot of it comes down, and this is not me making this is their opinion, my own psychological analysis. They said that they wished they had known more about all the processes so that they could be more mentally prepared, because when all of these new things are happening so quickly, it can feel traumatic. And I guess that's one of the reasons also why I struggle with the narrative of, the only birth that's beautiful is unmedicated and in your bathtub at home, because pain is such a subjective thing and no labor is the same. So let's say, somebody, I don't know, like they were abused when they were young. They might feel pain in a very different way than someone who has never had that. And then they go into labor and that pain feels like 10 times what it felt like for that other person. And it's bringing up trauma. And this is just one case scenario. For them, maybe having an epidural would have made the process so much more enjoyable, and they'd want to have another kid, and they felt safer and more in their body. I don't think it's so simple to just say, oh, I'm going to do it at home. And that's always the best case scenario. I just think it's not that black and white, and it overlooks a lot of things.
And I think, that's often a question that I get asked often in clinic is, should I go in with, a written down birth plan of everything that I want? And I actually tell people no. So what I recommend is, have some, general ideas, wishes of what you'd like it to look like if everything is uncomplicated. But the most important part is to be open-minded. Labor is not planned. Labor, when you have it, it goes. You can't plan it. So it's super important to be open-minded and trust in your medical team that you're going to make decisions together that's safest for you and for baby. I find when people come in with a super strict plan of what they want or what they don't want, a lot of the times it actually doesn't end up happening. And that just leads you to have disappointment. I wanted to go natural and it didn't happen. And then you're disappointed in the process. But at the end of the day, like I said, you have a healthy baby. And, sometimes things don't go as planned, but it's always in the best interest of mom and baby. And sometimes, kind of like what you mentioned, like people who have like a history of trauma, like it's true. Everyone experiences pain so differently. And it can come up in ways that you were not expecting. And sometimes, I'm not against epidurals at all either. Sometimes they're actually necessary to help you progress and to help like relax mom to continue going through the process. So, there are advantages of having an epidural as well. And just being open-minded to anything that could possibly happen is a super important, outlook to have.
It's a really great point. I guess I wanted to just ask your comments too about the whole movement about, the only beautiful birth is an unmedicated birth.
Yeah. Like I said, every birth is beautiful, no matter what way baby comes out. I think the best part that now that I don't cry, but the part that I still that I'm every time gets me is just like showing or handing baby over to the parents and seeing the look on the parents' faces of like that first look of like, oh my God, this baby is here. And in that moment, a lot of the times you just forget about everything that just happened, no matter which trajectory your labor or delivery went in. Like the end result is that this baby is here, and that is just the most beautiful moment that can happen. And you know, I think we often also think of like like unmedicated birth is beautiful, but not everyone even wants an unmedicated birth. There are a lot of women, you know, on the other side of it who are going into it like, I want medications.
Give me all the drugs.
It's not. Yes, a lot of people want an unmedicated birth, but there's also a lot of women, you know, who want a medicated birth, and obviously within reason and what's actually medically necessary at that moment. But yeah, I think any birth, no matter, you know, if it goes as planned or not, in the end is beautiful when everything works out.
I agree. And I'm so happy that you're coming on here and really showing the humanities side of a doctor. Like you cried all during residency when you would deliver, because again, that narrative that bothers me in like this alternative healthcare world is that, like, you know, it's like doctors have no soul. They don't care. They're not empathetic. They're just like cold to everything. And part of the reason that I wanted to have you on here is because I know like how much of a vocation this was for you, and I wanted to have you on here to emphasize that. So yeah, I don't know if you had any comments on like just how much like of a vocation your career is to you, because I just hate how it's like doctors are just pill pushers who don't want the best for you. And I'm like, I've never seen that. I know so many people in the healthcare field at this point, like the conventional medicine, and I don't know, I guess I resent that.
I mean, I think there's definitely an aspect of like doctors prescribing medication, and we have to do it when it's necessary. And medication, drugs, let's say pharmaceutical drugs, are not necessarily bad. And, you know, we know over the years, like research wise, like medication saves lives, but that's probably a small part of my job. Like my job is, you know, especially nowadays, you know, with alternative medicine and like preventing diseases, prevention is a huge part of my job. You know, we have so many things like obesity and diabetes these days, and trying to get to the root of it by healthy habits, exercising, eating well, having a good mental health is a huge part of my job. So I can go a day where I feel like I'm a psychologist to a social worker, a counselor, and then taking on like these specialist roles as much as I feel comfortable in, you know, from being a pediatrician and doing more gynecological things. So it's so big, and I never stop learning because of that, because it's so much more than just diagnosing and treating. And I think even just COVID has proved that with the amount of like mental health people have struggled with over the last 2 years. Like I'm seeing every day in my clinic the impacts of this still. So it's so much bigger than I even ever imagined being a family doctor would be. It's not necessarily things I saw in residency or med school, but now that I'm really in it, I'm like, wow, what I do is massive, and there's still so much, you know, to learn and to do going forward.
Yeah. I just lost my train of thought. Oh yes. I think I was always surprised by your surprise at how many people see you for mental health, and like how, you know, you started your career and it was extremely heavy and dark. And I always think, and this is like, to bring the vocational spirituality into it, is that, you started in mental health as an occupational therapist. And I think, and I don't know if you agree with this, but this isn't to any doctors listening. This is me, the alternative person saying this, is that like, some part of like the universe or higher power has brought those people to you. I think you're probably very well equipped to deal with it, because I have seen how few resources there are out there for mental health, and especially to the point where people aren't functional. Like there's nothing out there. And eventually I want to have you back on to like deep dive into that. But anyways, it was just another way I wanted to compliment you that I think your patients are very lucky, and I know it's probably tough to have a lot of mental health, but I also think you were put there because you have the tools and you're like the strongest person that I know. No, you really are one of them.
Thank you. I think my training in occupational therapy has definitely helped become and create the doctor that I am today. Because like I said, so much of my job, it's not just prescribing medication. So much of it is listening and counseling and being there for patients, which is often why I run late, because I always let patients release everything they want and not cut them off and throw them out the room. Yeah. So it has its advantages but disadvantages too.
Yeah. Well, I think totally, like obviously your training as a family doc looks at the person more holistically, but also, I don't know a lot about occupational therapy, but a lot of things you have said to me over time have stood out to me. I was always probably too hardcore about exercise and health and fitness. And then you would just be like, it's okay. It's good that you went on a walk today. Like, in order to move your body, like take the stairs instead of taking the elevator, do this. And I was like, oh yeah, I can do the simple things. I don't have to just go and do CrossFit twice a day. So yeah, I think I could definitely see how that would help you, just being able to, step away from like just the medicine brain and into the like, what is this person doing on a daily basis? Mm-hmm. Yeah, it's interesting to see how that's helped you. Okay, so I wanted to know if you had any resources for women's health that you knew about in the public system that, let's say, like not everybody knows about, or that's underused and you wish more people knew existed.
Yeah, well, unfortunately, there's not that many public clinics or services that are available for women's health as a whole. Of course, you can see your family doctor, or if you have a gynecologist, for things like PAPs and certain issues like that. But especially in the West Island, because, I know there's not many resources and easy access to seeing someone, for simple women health needs. Me and my colleague, Dr. Amanda Gibbs, we actually created a clinic especially for this. So we call it, the Women's Health Clinic or Sexual Health Clinic. Of course, one of the things that we do in that clinic, is pregnancy follow-ups. But we also see people for their regular Pap tests. We see people for sexually transmitted infection screening and treatment. We see actually males and females for that. Nice. We do contraception counseling. So, people who want to know what's the best option for me, such as birth control pill or the patch or the ring. So kind of, really discussing those options, which is great when you actually have the time with someone to ask all your questions and go through your concerns, rather than just say, okay, these are your options, think about it, and I'll just prescribe you whatever. We really take the time to see what people's concerns are, what they haven't tolerated in the past, what they're looking for in a type of contraception. We also do IUD insertions and removals, as well as the contraceptive implant insertions and removals. preconception counseling as well. So that's kind of, like if someone's thinking of becoming pregnant, and they just kind of want to get some information before, like when do I need to start prenatal vitamins? We kind of do this evaluation, ideally a few months to a year before, really to make sure if they have any medical problems that, things that need to be controlled before, to really make sure they enter pregnancy in optimal health.
So would you recommend for every woman, a year out from having birth to maybe book an appointment to just kind of go over those points and points that they probably have never thought about?
Yeah, I think it's obviously not necessary, but is it something that's beneficial? Of course, because there might be things, that you don't even think of before getting pregnant, things that are so simple, that we discuss in that appointment. Most people, at least that I know of, don't do this appointment before getting pregnant. And a lot of times pregnancies become, you become pregnant unexpectedly. It happens a lot. So kind of being prepared as much as you can be in advance, and knowing what you should or shouldn't be doing in preparation for an upcoming pregnancy is something super beneficial. And it's a free service, where our services are all covered by RAMQ. So you're not losing anything by having that.
Oh, that's great. Maybe I'll just talk a little bit more about that subject. Is there anything that you commonly see, or kind of like do's or don'ts? Because I feel like everybody that I talk to's pregnancy was a surprise almost. So like, at what point should women be on their prenatals, I guess? Should they be tracking their ovulation and testing, like planning their alcohol consumption, drug consumption? Like what are some, like, I don't know if there are any like common mistakes that you see that you could give guidance.
So I think
about.
like, for example, prenatal vitamins, ideally we say, 3 months before becoming pregnant is a good time to start them. However, I tell every female that has the capability of becoming pregnant to just always be on prenatal vitamins, or really it's just a multivitamin that contains folic acid. And the reason why it's any person of reproductive age that's, capable of becoming pregnant is because of that. There's so many unplanned pregnancies, and this is something, so simple that you can take every day that can really benefit a pregnancy.
Okay.
So that was one of the things. I mean, for sure, for people who are really like planning, let's say, okay, in 3 months, like August 1st is the day I'm starting to, to try to get pregnant. I tell those people, if you're really planning at that time, then you should almost treat it as if you're pregnant. So, avoiding raw foods, not drinking any alcohol, not smoking cannabis or cigarettes, really treating it as if you're pregnant, so that when you do become pregnant, you kind of optimize as much as you can, like your physical state. Okay. So those are just a few examples. And of course, that's really for someone who's overall healthy. But of course, if there's people that are, already have any underlying health problems, and that's like a bit more specific into to how to control those conditions beforehand.
Okay. So I wanted to ask one more I guess I already asked this, but I guess just from a fun perspective, how do you find having kids as your patients? For me, I love when they're little babies and you can do all your tests, but then the second they become toddlers and they know the word no, and like it's like stranger danger, I find it challenging. So I was just curious, like, I don't know if it brings you joy. How do you find treating kids?
Yeah, no, I love it. I think it's one of the highlights of my clinics. Like whenever I do like my baby and kids clinic, most of the time, babies and kids are in a good mood. And usually when there's one screamer, the entire rest of the day is kids screaming. That seems to be how it is with me. But overall, it's fun. It's so neat watching children, even from birth, because a lot of, the patients that I follow during pregnancy, and then I even delivered some of them, seeing them from that moment, as they grow up,
So nice.
is so cool, because you see physically how they change, but also just like with time, like kids are always evolving. Like it's so neat to kind of follow them through that whole process.
Love that. What's something you wish all moms knew?
Wow, motherhood is such a unique journey, and I feel that a lot of moms are always comparing themselves to other moms, their friends when they were pregnant, or, well, my friend's kid did this at this age and mine's not doing it yet. Every process is different and unique. Every pregnancy is unique, every labor and delivery is unique, and every child is unique, and they grow and meet their milestones at, different times. So just kind of trust the process, trust yourself, don't always compare yourself to others. It's enjoy the moments that you have. And that just makes it more enjoyable.
That's, very insightful. So if somebody, so I guess it's kind of not a funny question, but a lot of women that I treat, they're always apologizing for their legs not being shaved if I'm examining their knee or their or their feet, or like anything in the region of their calves. So I was just wondering, to clarify, and I guess there's a lot of funny TikToks out there about this now too, is what's the proper hygiene to receive a gynecological exam? What should women be doing before an appointment?
I have all the time. There's always someone who's apologizing for their legs or having not shaved. And there's really like no specific etiquette. Like, you come as you want to come. If you didn't shower, that's okay. Whatever is natural to you, whether you shave, whether you don't shave, you wax, whatever look you want, that is you. And we're going to have absolutely zero judgment on what anything looks like down there. So there is no need to prepare anything. And we won't even remember anyways, to be honest. Like the amount of like gynecological exams that we do, like, I don't even remember. But I'm always telling people, like, don't apologize. It's fine. Like, you do you.
They've seen a lot of vaginas, so you really don't have to worry.
I think a lot of people are concerned with like their period, though, for example. That's the one time that, like, depending what you're coming in for, it might be something that needs to be rescheduled. Like, for example, if, the plan is to have a pap test and you're like really in the middle of your flow and it's quite heavy, then sometimes we have to defer it just because the blood can kind of obscure other cells, for example. But if you're coming in, for an IUD insertion, for example, we actually want you to be on your period. So it really, depends on the situation.
All right. Well, that came to pretty much the last of my questions. Was there anything else that inspired you, or that you wanted to make sure everybody heard?
Yeah, I guess I just want to say that, for the clinic that me and Dr. Gibbs run, it is accessible to the public. No one needs a referral to come see us. Our entire goal and mission is just for women's healthcare and sexual health to be accessible to the public, without having to wait, 4-6 months to see, maybe a specialist just for something like a pap test. Or maybe you have a family doctor, but they just don't even do pap tests. So any of the services that, we kind of mentioned above, those are things that you can just call. You'll be seen by us relatively quickly. We try to see people within a month, so that, it's just always accessible, these simple services.
So how can somebody get an appointment for the sexual health clinic?
So for now, the way we're working is that anyone can just call the clinic. The clinic that we're working at for now is Clinique Medicale Beaconsfield. I guess we'll post the number in in the comments
I'll
or something.
Put it in the copy. I'll put all the information for the clinic.
Yeah, so people can just call the clinic. Like I said, no referral. They'll just be put directly into the schedule depending on the urgency and what the need is. Okay. Yeah, and then we also have an Instagram page where we occasionally
have really
post
fun videos.
When we have the time, that we post videos on certain women's health topics. So that Instagram page is called West Island MDs, if anyone wanted to check it out.
Do yourself a favor and do it. They make really funny videos. And for anyone trying to educate their kids on, or teens on sexual health and wellness, they do it in a very fun way. So I highly, highly recommend.
We have a lot of fun doing it. It takes us too long because we just laugh the whole time. So that's why we can't post too many videos.
Well, I just want to thank you, Tanya, for taking the time, Dr. Hirschbees, for taking the time to come and talk with me today and enlighten all of us on the role of a family doctor in pediatrics and obstetrics. And I am very grateful.
Well, it was a pleasure to be here.
Okay. Well, thank you and have a great rest of your day.
You too.